the patient family can influence the choice of his decision. Especially I remember one case, had a patient, a trauma patient, and he was, I think, 16 years old, and they were in a school trip for excellent student, and this patient was among this trip, and they had accident, the bus fell down from the bridge, and this patient had very complicated wound in his leg. And the bone was exposed. There was some missing fragment of the bone. We took maybe 2 to 3 hours stressing this wound. And sometimes we need to take the patient to the OR for dressing, for the intolerance. And it took us a long time because the decision of the father, he's not accepting the patient to amputate his leg. And this caused him to have more infection, prolonged hospitalization, burden his immune system because of the infection. So until we sat down with the patient, we did a family meeting with the patient, with the father, and we explored the option that he can have even with amputated foot. And alhamdulillah, he agreed. So, although it took a long time, but eventually he agreed. And he did amputation. And he continued his life. I asked him for his permission. So unfortunately, he did not to share his picture. This patient, after 3 or 4 years, he sent me a message. His photo sitting in a coffee with his prostate and putting a leg over another. And he was saying, thank you for the decision you made at the time. Actually, it's not a personal effort, it was a team effort. But all these stuff can make the difference, and only just including the family. Assistant with wound care. Also, we can educate the patient for facilitating his his discharge from the hospital, how to do the dressing, when to reach us and how to reach us. Traditional and natural influence. Some patients still, anyone knows the common herb or traditional medication or herb patients would like to use, especially when they're wounded. Murra. What? Honey, what else? Khawaja. Well, you know, before I started wound care, I didn't know what is khawaja was. Then when I started wound care, can we put khawaja for? What is khawaja? Well, khawaja is a herbal medication, red color, and it's burn cases. Yeah, you will see the patient with red something covered that goes, and this is the presentation. So we should consider the patient or culture or preference. Sometimes for my practice, if he would say, I want to use murra, then I would tell him, you can take wash your leg with the murra, then come to us, we will clean almost the sterile way and put medication of intended rescue. Modesty is a fundamental aspect of Islamic techniques affecting the how patient and is interacted with healthcare providers. We have some always they are saying that females doesn't want only female to take care of. And if you will know, if some males will refuse to have a female nurse to do the thing for them, especially if it affects the private area. So we talk about traditional health practice from traditional techniques and how to integrate the modern medicine with the traditional practice. Key consideration. This is a key consideration when dealing the cultural or health medication. Respect the cultural belief, acknowledge the patient condition and belief, ensure safe integration, how we can use this safe or traditional medication safely, and educate the patient on the danger of using shelf medication or street medication. So, patient communication and language barrier. Some of us think only the language barrier is patient is speaking English and we are speaking Arabic. Sometimes even if you speak English but you use medical terminology, this is another issue for the patient. You will say now your wound is improving, the wound is macerated. Patient will not understand you. You have to choose a common language or a simple language to talk to the patient. And you should explain to him. Sometimes even we have this incident. One patient, her mother was with end-stage superficial injury, and she was happy with this stage. She's saying the wound is healing. After a few days, the wound opened, and of course it was deeper and more necrotic tissue under the crust that was there. So the patient complained that the wound is deteriorating. There is neglect from the team. But if you come through, because you have to sit with the patient and tell her that actually it's improving. The crest was discovering it is beneath it, and this now it's open. So it's not deteriorating, it's actually healing. Effective ways to communicate wound care and instruction. We have to simplify as much as we can the instruction to the patient, how to do it, what type of diet he should eat. Dietary and factor, impact of diet. Some regions they have first for acid, they like to eat more, they eat more. And even the prevalence of diabetes varies from one region to another region. And we should take this in consideration. Lifestyle can affect wound healing. As I mentioned, if the patient like to take a daily, if the patient is more active, all this we should consider when managing the care plan. So challenges in wound management, misconception of medical intervention. Some of the patients will have a misconception of what is the care, or especially when using advanced treatment like negative pressure, or even as the treatment that was we discussed of the course. Delay seeking the medical attention. Some patients will say it's only redness, it's going to heal. But he doesn't know that these are signs of infection, and it's alarming sign for him to come to the hospital. He will come to you when the wound is already deteriorated and needs further more drastic measures. Influence of social norms and treatment theory. So in conclusion, I tried to make it short because I noticed most of the aspect was covered in the enormous way. So cultural awareness enhances patient care, family and caregiver play a crucial role. Modesty and gender preference must be respected. Traditional practice influence the medical decision. Sometimes you should consider what the patient wants and try what he wants. Even if it's strong, sometimes it will be easier to you to show him his choice is not correct, so he can adhere to your treatment. Preventive practice and mental health care, education and training can over the. And thank you. This is all covering the cultural aspect of wound management. Anyone have any question or anything you'd like to share with this big part? I hope my voice did not irritate you.
Thank you, Ms. Malak, to share your experience with us. From the audience, we want to ask you, how do you wound care the nurse here from the hospital, from our hospital? She wants to share with us a small story. Anyone can share your experience with us? Anyone from you he wants to share the experience of success and with the patient from your scope for. Nobody? You did not deal with patients? You did not hear anyone? Huh? Who? Yeah, I am sure Bassam, he will share with us. I have with him very huge moments. Okay, alhamdulillah. Okay.
Morning everyone, my name is Ibrahim Abdullah. I'm a nurse at King Fahd Hospital of the University, Medical ICU. So just now I want to share a brief story that I had in my department, that I saw a stage 3 wound, and that was the first wound I saw in my department. Then I was asking and I was wondering how to deal with these wounds. Then my head and my charge nurses was telling me that we just need to position and we just need to change the dressing as much as you saw socks, we need to change it. So after months, I saw the wound already improve until it healed. That was really unbelievable to me that this big wound or this horrible wound I can mention healed already.
Bassam, he did not close any wound in his life. Never. We did not talk with each other. You are with us in your hospital. Okay, Mr. Reddy, you want to share the story?
Hi, good morning. I'm Shanti from King Fahd University Hospital, working in OR. I'm telling about one patient, trauma patient. That is, I'm only 4 years back. I'm telling about the patient. The patient came to OR. It was very big wound. Our orthosurgeons, they used the back dressing. This negative pressure, which is negative pressure dressing. It healed really so fast. Within 3 weeks, there was improvement. And we closed the wound, the patient healed well. It was a very good experience. Thank you.
Thank you, my dear. It's nice to hear this one from us. You are from us. So usually all they are starts with the wound. But with us, we are pushing the patient for them to clean and to apply the back. Thank you. Okay, Sirajul, he has a story to share with us.
Good morning everyone. I'd like to share a story when I was once a frontline nurse in a medical hospital unit. Now, during this time, we had a patient who was quadriplegic actually, the patient, and he was post-car accident. He cannot be admitted in Prince Sultan Rehabilitation Center in Riyadh because of a stage 4 pressure injury in the sacral area. And imagine this patient is quadriplegic. That was also the challenge. So during that time, I will not tell you what year was that. You might guess my age. I was one of the very first nurses who was trained to use the back dressing, the vacuum assisted closure dressing. And we used it for that patient. I think one of the important elements of wound healing is not only the modalities that we apply. It's about the commitment of the patient, the commitment of the family. So imagine for this patient, and we followed his wish. He wants to take his bath 3 o'clock in the afternoon, around visiting time. And as nurses, we made ourselves flexible to that. He wants to take a bath to make sure that at 3 o'clock in the afternoon when he takes his bath, both his sons are there, visiting time. We made that possible for him. And because of this commitment from the family, from us as the care team, in a very short period of time, the wound, which was stage 4 of the sacral area, healed completely, and eventually after 4 months, I was the one also who transferred him to Prince Sultan Rehabilitation Center. So the message is that I know for nurses in the floors, we have routines. Sometimes, no matter if the patient wants it or we don't ask, we bath the patients at 3 o'clock in the morning. Give the patients their autonomy because they need to be part of their care. Thank you.
Thank you, Sir Ryder, for this insight. I just want to say another thing just came to my mind while he was speaking. I always say to myself, we usually meet those patients in the worst days of their life. And we need to adjust to their preference. We need to accept what they want. We give them the simplest modicity or the control over their treatment, even if it's simple, it will reflect a huge amount. Since we're telling the story, it came also to my mind, you bear with me. This is a story, and this is my personal story. Wound care course was a long time ago in our hospital by Dr. Ayman Saad with the collaboration with business. So one of the times they was junior wound care there. So I wanted to participate in that course. I outreached to Ms. Najla, I told her I want to do something in my life. I wanted to participate in this course, so she and Dr. Ayman Saad gave me the chance to, they said, what to give you, what to give you. You know what, we have a station, you can stand and just share your simple experience. So I agreed. So when I was sitting with all this, I expected the chance, and I really appreciated the chance at that time. As I was sitting at the audience and I'm looking to Ayman, and then he was presenting his presentation. So I said, one day I will own it, and it will be mine, and I will impact it. So today, so if you dream it, you can own it, inshallah. So pursue your dream, everyone.